dearest guests, good morning, and welcome to Rwanda. I would like to echo my Honorable Minister and my colleagues to welcome you in Rwanda. For those who are conversant on social media and reading news, there's a trend hashtag, Visit Rwanda. So I'm very happy that today the organizers and members of Interest Platform decided to take us through that trend, to visit Rwanda, not for tourism only, but also for the scientific exchange on HIV control and response. So I'm going to take you through the Visit Rwanda to understand the community perspective. Next slide, please. Okay. So as Honorable Minister said, and the DG of RBC, our government help us to strengthen the health system. So if you look at the health system pyramid, you will understand what inspired the community perspective. So if you look at our health system pyramid, we started by really emphasizing on community level. Our smallest administrative unit is a village. And we thank the government of Rwanda to think about how the system or the health system can be strengthened from the community. By doing so, I think you have heard that we managed to expand the HIV services coverage in Rwanda, reaching the community again. And today we have 98% of our sites providing VCT services, PMTCT services, and ART services. But again, as my colleagues said, we have to work as government, private institutions, civil society organizations, but also the community. So I'm going to take you through the community-based interventions. These are our cornerstones of our success, if I may say. We attribute our success to the four cornerstones. We have the Ministry of Health and government institutions to provide policies and guidelines, but also to make sure that the implementation of national program is very well coordinated. And we are thankful for our partners in HIV response who are providing technical support and financial support, but also contribute to the development of the national guidelines and strategies. We also recognize the civil society organization like my foundation and others who are here in the room and elsewhere in the country for their contribution to support the government in implementation of the program. How can I forget the association of people living with HIV? You have to start by people who understand what they are living with. So we really recognize that the community perspectives are also inspired by the network and associations of people living with HIV who are providing peer adherence support and contributing also to the development of the national guidelines. Here, let me take you through the Rwanda network of people living with HIV. They are providing prevention, care and treatment, social impact and advocacy to make sure that people living with HIV are really living positively with HIV. And we are happy today that we have more than 120,000 members who are really contributing to our national strategy for transformation, who are contributing to the African Union Agenda 2063, and therefore the achievement of the Sustainable Development Goals. They are members grouped in different levels, and they're also mobilized to actively participate in HIV response. There is a structure we always have to talk about when we are gathering like this. We have community health workers who are our health drivers, our drivers to the universal coverage of health services. So this is a structure that really helped Rwandan community to understand the interest of accessing services. So they have been established in 1995, and we have at every village, as I mentioned, we have 3 community health workers, and they are all, including others, is also mobilizing the community to access HIV-related services. There are many civil society organizations, but let me start from my home. So Imbuto Foundation, we're driven by E to the power 3 for the scientists, I think you understand. So whatever we are doing, we make sure that we engage, we educate, and we empower the community. Our foundation has started as a project called Protection and Care of Family Against HIV and AIDS, PACFA, to respond to the severe epidemic affecting the Rwandan society, as DGRBC mentioned. And from 2007, PACFA embraced more programs and changed its name to Imbuto Foundation, which stands for a seed. Imbuto means seed, and this was initiated by Her Excellency, the First Lady of Rwanda. So today, we are providing our contribution to the national strategy for transformation through around 16 projects. And whatever we are doing, we focus on young people, and we make sure that our adolescents, if you remember the previous presentation, we have a challenge to reach the adolescents. So we are helping, we are supporting the government with other different civil society organizations to make sure that adolescents are receiving services, but they're also taking part of that HIV response. This is our coverage in different programs. So we are making sure that there is, whatever we are doing, we have to have community commitment. So I think DGRBC and our Honorable Minister mentioned that we managed to decrease the mother-to-child transmission from 10 to now 1.5%, but we still have to reach all the adolescents. With the community commitment to end adolescent AIDS, I think we will go there. So here I'm presenting a picture of Her Excellency, the First Lady of Rwanda, who was launching the All-In campaign. It's a continental campaign to make sure that all the adolescents are reached by HIV services. And here she was awarding 5 districts that had no child born with HIV positive from the infected mothers in the last 5 years. To reach the adolescents, because now we realize that our children are now, we are now trying to make sure all children are born free of HIV. But we have to make sure that they are staying free of HIV. So we have to come up with innovative community HIV awareness and strategies to reach these young people. And together with the Ministry of Health, we are trying, and other partners, we are trying to establish the youth-friendly services and youth corners in the health centers. What are the community returns in these achievements? By increasing access to ART in Rwanda, we can say that substantial gains in life expectancy among HIV-positive individuals was observed. And we are also happy that the life expectancy is now improving. So there are many, if you go in the community, you understand that there are many community returns as a result of the achievements. What is our new lens now? So our new lens is to contribute to HIV case findings, as DG RBC said, and we have to make sure that our young people and they go for uptake of HIV testing, they know their HIV status, they go for treatment, therefore we will have the viral load suppression. So our new lens, as I said, is to know, treat, and suppress to build the Rwanda we want. Thank you.